When we cut ourselves or get hurt, our wounds start to bleed, and here begins the complex process of stopping bleeding, in which coagulation factors and vitamin K participate. Vitamin K is important for blood clotting and healthy bones, and also has other functions in the body. What are these functions? We will discuss in the current video. My name is Dr. Zarifa Romanova. Welcome to my YouTube channel. Vitamin K is a fat-soluble vitamin that comes in two forms. The main type is called phylloquinone, found in green leafy vegetables like collard greens, kale and spinach. The other type, menaquinones, are found in some animal foods and fermented foods. Menaquinones can also be produced by bacteria in the human body. Vitamin K is found throughout the body, including the liver, brain, heart, pancreas and bone. It is broken down very quickly and excreted in urine or stool. Because of this, it rarely reaches toxic levels in the body, even with high intakes. Vitamin K helps to make 4 of the 13 proteins needed for blood clotting. These proteins stop wounds from continuously bleeding so they can heal. But in some people, blood clots could be forming in the heart, lung or legs and could lead to harmful effects for the body. Doctors prescribed anticoagulants, also called blood thinners, to prevent formation of blood clots. Vitamin K has the potential to counteract the effects of blood thinning medications. Minor changes in vitamin K intake rarely affects blood clotting. However, large and sudden variation in intake can interfere with medication's effectiveness. Vitamin K is involved with the production of proteins in bone, including osteocalcin, which is needed to prevent the weakening of bones. Some studies have shown that higher vitamin K intakes are associated with a lower incidence of hip fractures and low bone density. A report from the Nurses' Health Study suggests that women who get at least 110 micrograms of vitamin K a day are 30% less likely to break a hip than women who get less than that. However, the results of clinical trials and meta-analysis have been conflicting whether vitamin K supplements reduce bone fractures. This may be due to a variety of other factors that affect bone health, including a lack of calcium, vitamin D, and weight-bearing exercise, all of which might mask a benefit of vitamin K supplementation. A few studies have researched the role of vitamin K for heart health. Vitamin K is involved with the production of specific proteins, which help to prevent calcification or hardening of heart arteries, a contributor to heart disease. Because research in this area is very limited, we need additional studies. Food sources of phylloquinone include vegetables, especially green leafy vegetables, for example, collard and turnip greens, kale, spinach, broccoli, Brussels sprouts, cabbage, lettuces, as well as vegetable oils and some fruits. Meat, dairy products and eggs contain low levels of phylloquinone, but modest amounts of menaquinones. Natto, a traditional Japanese food made from fermented soybeans, has high amounts of menaquinones. Smaller amounts of vitamin K are found in meat, cheese and eggs. Few foods are fortified with vitamin K. Breakfast cereals are not typically fortified with vitamin K, although some meals replacement shakes and bars are. An adequate intake, AI, is used when there is not enough evidence to establish the recommended dietary allowance. The AI amount is estimated to ensure nutritional adequacy. For adults 19 years and older, the AI for vitamin K is 120 micrograms daily for men and 90 micrograms for women, and for those who are pregnant and lactating. The AIs for infants are based on the calculated mean vitamin K intake of healthy breastfed infants. Furthermore, infants received prophylactic vitamin K at birth as recommended by American and Canadian pediatric societies, and these quantities are also taken into account. For children 1 to 3 years, the AI for vitamin K is 30 micrograms daily. For children 4 to 8 years, the AI is 55 micrograms daily. For children 9 to 13 years, the AI is 60 micrograms daily. For adolescents, the AI for vitamin K is 75 micrograms daily. Vitamin K deficiency is very rare. Most people in the United States get enough vitamin K from the foods they eat. Also, bacteria in the colon make some vitamin K that the body can absorb. However, certain groups of people may have trouble getting enough vitamin K. Newborns who don't receive an injection of vitamin K at birth. People with conditions such as cystic fibrosis, celiac disease, ulcerative colitis, and short bowel syndrome that decrease the amount of vitamin K the body absorbs. People who have had bariatric weight loss surgery. Vitamin K deficiency may occur in people taking medications that block vitamin K metabolism, such as antibiotics. The following are the most common signs of a deficiency: a longer time for blood to clot, or a prolonged prothrombin time as measured in a physician's office, bleeding, hemorrhaging, osteopenia or osteoporosis. Severe vitamin K deficiency can cause bruising and bleeding problems because the blood will take longer to clot. Vitamin K deficiency might reduce bone strength and increase the risk of getting osteoporosis because the body needs vitamin K for healthy bones. The Food and Nutritional Board (F&B) did not establish upper levels for vitamin K because of its lower potential for toxicity. In its report, the F&B stated that no adverse effects associated with vitamin K consumption from food or supplements have been reported in humans or animals. However, it is not recommended to take more than 500 micrograms of synthetic vitamin K. Most people get plenty of vitamin K in their diet, so supplements are usually not needed. Water-soluble forms of vitamin are manufactured and may be beneficial for people with problems in fat digestion and absorption. Multivitamin supplements are available with or without vitamin K. Common forms of vitamin K in dietary supplements are phylloquinone and phytonadione, also called vitamin K1, minaquinone 4 and minaquinone 7, also called vitamin K2. Minadione, which is sometimes called vitamin K3, is another synthetic form of vitamin K. During the 1980s and 1990s, it was shown to damage hepatic cells in laboratory studies, so vitamin K3 is no longer used in dietary supplements or fortified foods. Vitamin K interacts with a few medications. In addition, certain medications can have an adverse effect on vitamin K levels. Individuals taking these and other medications should discuss their vitamin K status with their healthcare providers. Antibiotic medicines may destroy vitamin K producing bacteria in the gut, thereby potentially decreasing vitamin K levels. This effect might be more pronounced with cephalosporin antibiotics. People who have a poor appetite while using long-term antibiotics may be at greater risk for the deficiency and may benefit from a vitamin K supplement. Vitamin K can have a serious and potentially dangerous interaction with anticoagulants, such as warfarin and others. These drugs antagonize the activity of vitamin K, leading to the depletion of vitamin K-dependent clotting factors. People taking warfarin and similar anticoagulants need to get about the same amount of vitamin K each day, because sudden changes in vitamin K intakes can increase or decrease the anticoagulant effect. Bi-acid sequestrants such as cholestyramine and cholesterol are used to reduce cholesterol levels by preventing reabsorption of bile acids. They can also reduce the absorption of vitamin K and other fat-soluble vitamins. Vitamin K status should be monitored in people taking these medications. Orlistat is a weight loss drug that reduces the body's absorption of dietary fat, and it can also reduce the absorption of fat-soluble vitamins such as vitamin K. Combining orlistat with warfarin therapy might cause a significant increase in prothrombin time. That's why doctors usually recommend that patients taking orlistat take a multivitamin supplement containing vitamin K. Severe diarrhea can be a sign of vitamin K deficiency, but you gotta check with your doctor before taking supplements on your own. If you have frequent nosebleeds, try to increase your vitamin K intake through the foods. Yogurt is one of the best defenses against vitamin K deficiency. Because vitamin K is fat-soluble, it is best to eat vitamin K foods with some fat to improve absorption. So, drizzle some olive oil or add diced avocado to your favorite leafy green salad. Write your questions in the comments below. Subscribe to my channel on YouTube and Instagram. Take care of your body and mind. Bye.